Thank you for the question. Insulin resistance is a pretty large topic. And I think what we need to start with, we need to understand what is insulin and why do we need to have it. Well, when we consume carbohydrates, the glucose gets into your blood, and then that glucose needs to get somehow into the cells. And insulin receptors is basically a key that unlocks the cell to open the cell to get the glucose inside of the cell. And when there's too much glucose floating around, those receptors will change their configuration. So the insulin, the key to that receptor, will not fit properly and will not open as much insulin receptors. So there would be not much influx of the glucose in the cell because cell already has enough. Well, there are certain organs in our body like liver and like muscles that are much more insulin sensitive than others. So if you have too much glucose flowing around, the glucose will be going to your liver, for example, and will form glycerides, which will triple in size and will become triglycerides. And that is the fat in our blood. But in reality, it comes from excessive glucose. So if we want to start reducing our insulin resistance, number one, we need to decrease amount of sugar or glucose that is consumed or getting in our blood. And we also need to increase the insulin consumption or glucose consumption in other organs that retain their insulin sensitivity, like muscles. So that's why exercises are very helpful with insulin resistance, and lower processed carbohydrate diet is also very helpful in maintenance of your sugar levels and decreasing of your insulin resistance. We'll be talking much more about insulin resistance because that's actually one of the core reasons why patients have high cholesterol. So those two things are very closely related to each other. Follow me for more and share with others.